I read the news so that you don't have to. How would you feel if Palantir, the company that works with military and immigration enforcement, had your entire medical history? I mean, your surgeries, your prescriptions, your DNA level data. Well, something's happening in the NHS. So before I get into the headline, I want to tell you what's going on just in case you're not up to date. The NHS has been rolling out something called the Federated Data Platform. Basically, it's a massive system that's designed to pull patient data from across hospitals, and the company behind it is Palantir Technologies. Now, if that name rings a bell, it's because Palantir isn't just some boring tech supplier. No, it was co-founded by Peter Thiel. Yes, Peter Thiel of the Antichrist speech in Rome, Peter Thiel. He is a billionaire with very strong, shall we say, political views, and he is known for working with the US military, intelligence agents, and immigration enforcement. So not exactly our friendly neighborhood NHS contractor. So the first headline I wanted to give you was this one. As you can see, it says NHS staff boycott Palantir's data platform over ethical concerns. Great to see healthcare professionals are actually advocating on our side, but wait, there's more. Because as the right hand giveth, the left hand taketh away. And this headline says, NHS data chief pushes for deeper rollout of Palantir technology despite the outcry. Yes, so the data chief says that the system is working and that it's speeding up surgeries, that it's getting patients treated faster and helping over 100,000 extra patients get operations. So internally, the leadership is basically saying, listen, just ignore the noise. We're going to push ahead. They want maximum penetration of the system across hospitals, meaning deeper integration, more data sharing, and more reliance on Palantir's tech. But obviously there's a problem because some NHS staff are refusing to even work on it. Because whilst efficiency is great, this isn't just about efficiency. This is about who controls the data and what they've done with data elsewhere. And even the government is nervous. There's already talk of potentially triggering a break clause in the £330 million contract next year. So this is pretty serious because this isn't just a tech upgrade, this is a philosophical battle about the future of public healthcare. Do we prioritise efficiency and speed or trust ethics and control over sensitive data? Because once a system like this is embedded, it is very hard to unwind. And so critics are basically asking, if a company builds the backbone of your healthcare system, do they eventually become too powerful to remove? Especially when that company has ties to defence, surveillance and political agendas. So the NHS may be saying, oh, but look at the results, but critics are saying, look at the long-term risks. So right now we are literally sleepwalking into one of the biggest data decisions this country has ever made. This isn't just about tech, it's about who we trust with our most personal information.